Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am your host, Dr. Kishore Valodi. And apparently, there is still this virus out there. This COVID pandemic is starting to wane, we hope, but you just never can tell. But I know someone who likes to pontificate about all things COVID. And I've invited Dr. Andy Nowalk to join us again. As everyone knows, Andy is a friend to the podcast and an ID expert, and as willing as always to share his knowledge with all of us here on the podcast. Andy, thank you for joining us.
Always happy to come. Always happy to share the puzzling sometimes, but always interesting news about COVID.
That's it. Well, one day, we will be able to talk about another infectious disease topic that is not COVID together, I'm sure. But for now, it is COVID all the time. So let me just ask, as we always do when we start one of these podcasts, can you give us just a little bit of a general update about COVID? Are we endemic? Are we pandemic? Is there a BA.2? All these types of things. Tell us what's going on.
Well, since we last talked about things, I think that we've gone through yet another unanticipated, didn't think it could happen phase of the pandemic as Omicron moved through the entire world. So if you guys remember from previous podcasts, when we were talking about the Delta variant last summer and fall, we had a pretty big surge in the United States that was notable for a few things. Number one, the Delta variant turned out to be very, very contagious. And so it took over all of the transmission in the United States in a very short period last spring, and then became the only variant we saw anywhere, which was remarkable. I think we talked about it on the podcast. I wrote a lot about it. It wiped out all the other strains. Used to be, we had some of the UK variant and the Brazilian, it was Delta. Mm-hmm. What we saw with that were a few things. Number one, it was very contagious. So cases went up again. We had a surge, and it was pretty severe. So the case mortality rate was still pretty high. And the other thing that we saw with it was we had at that point had a lot of kids go back to school. And so what we saw was a transformation of a previous pandemic that we had seen here in the United States that did not have much impact on kids. And it became a kids pandemic in the fall. September and October around the country, the highest rate of cases were in our 5 to 11-year-olds in our county, in our state, in the country. So it really transformed. I mean, you heard me be wrong on previous podcasts saying, well, maybe kids were more resistant to COVID. They turned out, no, it's just that they weren't in school together. And when we put them in school together, many of them not masked, which was a bad idea. I will repeat again. We saw this, surge. And then I was like, boy, that's a surge. And then Omicron said, hold my beer. And so, what we saw in the last 3 months was a strain that made the contagiousness of Delta look minuscule, amazingly. Now, Omicron is almost as contagious as measles, which is our reigning champion of contagious viruses. And so it's staggering. I've seen estimates that half of the people in the United States got infected with Omicron in the last 3 months. Those may be a little high, but they're not that high. Half of the entire United States, that's staggering. And fortunately, because everybody got infected, it did turn out that Omicron was less severe case by case. Mm-hmm. Now, so many people got infected that if you go to the CDC website today, 2,000 people died from COVID yesterday. 2,000 people. That's not non-severe to those people. So even though the overall rate of severe disease was lower, the number of people dying is still there because we saw so many infections. And we continue to see children die. The numbers have reached almost 1,500 during the pandemic, the majority of which were in the last 12 months. So we've seen a lot of disease. But something weird is happening. So what we are seeing now is not what we saw last winter. Last winter, if you remember, things kind of percolated through January, February, March, April, as that surge slowly came down. Mm-hmm. We've seen a dramatic decrease to almost summertime numbers with Omicron. Yeah. And we're still seeing nothing but Omicron in the United States. So it's the dominant strain, and it does seem like, having done its dirty work, it's receding in a way that Delta and Alpha never did. And making life a little bit better in terms of the overall transmission. So if boy, we've had some weird stuff going on. One of the other things that you asked me about before was, what about this BA2
You're
stealth
right.
variant?
Yes.
You know, let me tell you, Omicron was measurably, significantly more contagious than Delta. The BA2 stealth variant is, in some people's studies, 20%, 30% more. And when you look at the United States and you look at the amount of virus that's the original Omicron versus BA2 is increasing a little bit, but it's the same thing as Omicron. I wouldn't be concerned about Omicron. And there will be a pie, I'm sure, for sure.
Oh no, don't say it.
There will be, and that's how this virus works. But let's keep our fingers crossed that it's not as contagious as Omicron, because Omicron may have done us all a little bit of a favor by being the least severe but most contagious, because it may have given people a little bit of immunity that they needed, including boosting people who were already vaccinated.
So there's this concept in medicine we talk about all the time. There's a pandemic, which of course is what we've been dealing with the last 2 years, where the spread is so incredibly high and going all over the world even. And then there's something endemic, where we know that the virus lives in our population forever and comes maybe in the fall and the winter and goes away perhaps. When do we know whether we are out of the pandemic phase, or are we out of the pandemic phase yet?
I think as we continue to have these giant waves of infections that circle around the world, it's hard to say that we're out of the pandemic. I think there's so much variability from variant to variant that it's hard to say that we're out of that yet. And, one of the things that helps define a pandemic is a new strain that enters a community and then stays at very high levels. You and I were celebrating. Oh my gosh, yeah, we're doing so well. We're having, in our county today, we're having only about 100 cases or less a day. 100 cases or less a day was, a surge in the summer of 2020. So someone could reasonably say, well, our diagnostics are better, and they are. I mean, everybody and their brother has a home kit now. But I don't think we're going to be able to say that we're down to endemic until we see some real bottoming out. One of the things that helps define, for example, flu as endemic is in the summertime, it's not around, at least normal summers. Yes. Same thing with RSV, at least in normal summers. So I think we're a little ways yet before we can comfortably say we're going to add SARS coronavirus 2 to our pantheon of respiratory viruses and say it's just something we deal with on a regular basis.
Yeah. Okay. So we got lots of listener questions, usually right after our podcast, or certainly after there's a big change in the news stories and the news cycles. And what's been going through recently has been masking becoming optional in in a majority of schools in our region. I'm sure across the country, they're seeing maybe something similar too, where the schools have now become mask optional, and other group gatherings, church gatherings, things like that, mask optional. What are your thoughts on that in terms of what we're seeing? Has there been any change in numbers since these things have started to happen in the last few weeks?
Sure. I mean, what we're seeing is, if you look at the case rates, because, what you hear me talk about all the time, Kishore, is that I talk about the rate of infections in a given group. So we talked about 5 to 11-year-olds leading the way in September, October. They were unvaccinated, they were in school, and they were often unmasked. And that's why they led the way. When Omicron swept through, I mean, they drifted down to like 5th or 6th place among the age groups because everybody got it at once. And so there was nothing different about them compared to the other groups. We are seeing them come up again. And I think that that's going to be a result of the fact that schools are one of those places where you get a lot of people in the same room together in close proximity. And we're going to see that facilitate infections a little bit. Is Omicron less severe? Yeah. But are we going to see, I think, probably a little bit of an increase in cases as everybody's, thinking about taking their masks off? I think that's absolutely the case. What do you do about that is hard. I have, as listeners know, I have a 16-year-old with Down syndrome, and he goes to school in a mask still because I don't think there's such a small amount of disease yet that I would be comfortable with him not doing that. Yeah. There's a lot of societal pressure all of a sudden for people to take masks off, to go back to normal, or quote normal, unquote, whatever that means. So I think these are harder decisions. I would say you can never feel bad about being a little cautious and masking your child, because we know the data are irrefutable now. People with Down syndrome tend to have more severe disease with worse outcomes from COVID.
So we've been saying since we started doing these podcasts about how masks are more about protecting others than protecting ourselves. Would you say that there is definitely some benefit to the person wearing the mask as well?
Oh, absolutely.
Yeah. Okay.
Now you'll see a lot of news media saying masks don't work anymore. I love those stories. Masks don't work anymore. It's impossible. That was made up. You and I mask in our hospital, right?
Mm-hmm. Mm-hmm.
So if masks didn't work anymore, we should see hospital employees clearly getting infected by each other or by patients in our hospital on a regular basis. So we had a ton of patients come through with Omicron. You know what we saw? Not that.
Yeah.
So unless Children's Hospital of Pittsburgh is a unique place where masks work better than everywhere else, masks work. Yeah. The same things we've said a million times are true. A cloth mask is not as good as a surgical mask. Mm-hmm. And with a very, very contagious virus, obviously, your protection from a cloth mask has gone down. Mm-hmm. But masks still work. And where they still work really well is to protect the people around you mm-hmm. from you if you're sick. But they still work a little bit, N95 greater than surgical, greater than cloth, but they still work a little bit to protect you from infection too. We had a lot of people who are rigorous maskers not get infected in the Omicron surge. So, the most explicable part of that is they mask.
And what do you, we've had a lot of families ask questions about the younger children. So there are those under 5 who of course can't be vaccinated yet, but then there are also those under 2 who shouldn't be masking either based on CDC guidelines. And so what do you say to a family that says, how do I live my life with this young one who can't be vaccinated, or perhaps can't be masked either? How should they go about living their lives?
Well, I don't think I don't think you keep your kids in the house and never let them out. I think mm-hmm. you modulate risk and you modulate the things that you do appropriately. The same things still are true about transmission. It depends on how many people are masked, how far away you are from them, the rate of disease in your community, and vaccination obviously is such a huge part of that. So if you are a mostly vaccinated family and you're going to the zoo, go to the zoo and mm-hmm. you don't need to mask. Ventilation's really good at the zoo. Mm-hmm. Some would argue when you go in parts of the zoo, you wish there was more ventilation.
I was going to say that.
Or, those big open spaces, I think we can feel pretty comfortable. Small spaces where you don't know a lot of the people or vaccine status is uncertain are still going to be a little dicey. So if you masked a little more in that situation, I think that's reasonable. There's not one right thing to do now, unfortunately. Yeah. So I think everybody's going to have to make a personal decision about the level of risk that they're going to accept. And you may say, I don't want any risk for my child. Well, then they can't ever leave the house because you walk out the door, you incur some risk. But I think you can try to judge those things. And there are definitely some things that will work, I think, along the way.
And that advice you would say to the parent of a young one with Down syndrome, the same as you would say to any other parent.
Yeah, but I would always say the stakes are higher for the people with Down syndrome.
Okay.
In our family, we were always very aware, my sons, my wife and I, that we really had a responsibility to protect the most vulnerable member of our family. Yeah. And so we looked out for that. So I recognize that calculus may be different for you when you think about your loved one with Down syndrome. Mm-hmm. But I also think that what you decide to do is the right thing to do, but you can feel confident that some spaces are safer than they were.
Okay. And then, of course, we get lots of questions about COVID vaccine. We've talked about truly the miracle of this vaccine, how quickly it was able to be safely and effectively tested and sent out into the community, how effective those numbers, my goodness, I remember seeing those originally and just being wowed. And then over the last month or two, we've gotten some news media stories about how the vaccine is being delayed for the 6-month to 5-year-old group because they're not getting as much of an antibody response as they had hoped. We're seeing stories about the 5 to 12-year-old group wasn't as protected by the vaccine against Omicron when it was going through. So how do you answer a family that says, well, what are we doing now? Do we really need to vaccinate our young ones if it's not as effective?
Sure. This gets into vaccine advocacy, which I think is crucial for you and I think for everybody in our community. First of all, let's talk about the 5 to 11-year-olds first.
Yeah.
I saw a lot of news stories saying vaccine didn't work. But if you really read into that, what you saw is the studies looking at vaccinated kids and looking at how well it protected. It was not dramatic protection against infection. There was some. It didn't rise to, in the study group, significance, but there was definitely less infection in the vaccinated group. It was not, though, like what we had seen with the vaccine early on. And who would have expected that? This is a vaccine engineered against a strain that's been gone from the United States for a year and a half.
Right.
I mean, the fact that it's still performing the way it is a miracle. Thank you. But what those news stories always played down is it protected really well against severe disease. And if you look at the CDC data for vaccinated people, for example, in just December and January, when Omicron was raging, the protection against severe disease was 95% for most of those groups. So that for me, if it saves your life, it's a good vaccine, right? So yeah, it was not this unreal protection that we saw before. It looked a lot, honestly, like a flu shot. Flu shots generally underperform what we want them to do. And, we see these rates of infection and think, 60% effective, 50% effective. That doesn't sound that great until you realize that the protection against severe disease, going to the hospital, going to the ICU and dying, was much better than the protection against infection. And you know what? That's, in the end, if you're going to have a vaccine, what you want it to do is save lives first. If it prevents all infection and stops all transmission, great. Some of them do. But if this one doesn't, if it protects our loved ones from going to the hospital and getting in the ICU, then that's great. So I would caution people. People want to shout, masks don't work. They do work. The numbers have just shifted. Vaccine 5 to 11 didn't work. It wasn't dramatic protection against infection, but it saved a ton of lives in that group. And, we'd probably be looking at a couple thousand dead children right now, given the severity of the wave that we just saw, if we hadn't had vaccine. Just as a little, morality tale here, when we vaccinated 5 to 11s in our county, which the numbers I know very well, we vaccinated them. They were leading in the age group 5 to 11s in terms of case rate from September through November, seeing tons of virus. So all of a sudden, we were like, we have to vaccinate them. We vaccinate them. And in the early part of December, when we were mostly Delta, their rates plummeted 2 weeks after we started vaccinating them. We only vaccinated about a third of them in our county, but we were able to reduce their rate of infection by 2/3 simply by vaccinating them. So that's real world data that suggests that this vaccine worked a lot better than those stories are going to tell you. Vaccines work. They save lives. They save children's lives, and they save the lives of people with Down syndrome, period.
Yeah. And we were talking about the 5 month to 5 year old, 6 month to 5 year old age range, and kind of piggybacking on that. And you can answer this as well, probably at the same time. The COVID numbers, as we've been saying, are starting to decline. I've had families ask if this vaccine is finally seen to be effective and safe in that 6 month to 5 year old age range, but it's like April, May, and our numbers are still low. Knowing that vaccine works best soon after it was given, at least as far as antibody titers go, should they wait? These are well-intentioned families who want to vaccinate their children. Should they wait until the fall when we may see a new surge of COVID at that time?
All I would say is, if you had asked me if people could wait, let's see, December 1st on vaccine, and then what happened with Omicron 2 weeks later, what that tells you is you just never know. I would say, but I've said the whole time, just get your child vaccinated.
Okay.
When you have the opportunity, you just don't know what's coming down the pike.
Okay. All right. And then one other question that we get, some of our listeners, of course, have adult loved ones with Down syndrome, or at least those over 12, because I think the CDC says for people who are considered immunocompromised, they can get a fourth dose, so another booster, if they are immunocompromised. Now, we've talked about on the podcast before that Down syndrome by itself does not according to the CDC guidelines, qualify as an immunocompromising condition, like somebody who had an organ transplant is on immunosuppressive medications or something like that. But a family asked, could you just double check, is this something that a fourth dose for people with Down syndrome, is this something we should be doing?
I don't know.
Okay.
I don't. I think that what we've seen is with the third dose boost, we've seen nice responses in most adults and even the adolescents. We don't have the data we would like. There's some early data about Down syndrome that they don't respond as well, unsurprisingly. And so if that data comes out, gets peer reviewed, and we can look at it, that might suggest thinking about a fourth dose. But the CDC is really focusing on people. And this is some data that came out of Getty Hedar's group here in Pittsburgh, showing that like organ transplant patients with very significant immune compromise, they just didn't respond at all to the first two doses. It's not that they had subtherapeutic responses, but they did respond to a third, and then they boosted with a fourth pretty nicely.
Okay.
So I don't know, Kishore, we've been over this several times. People with Down syndrome are and are not immune compromised. Right. And so, certainly if your child has leukemia or is on bad autoimmune disease and on immune suppression, go give that fourth dose. That's a no-brainer. But in terms of the general stuff, I would say, if your state, for example, some states has set the guideline that people with Down syndrome qualify. If your state allows it, I don't think there's any downside to getting it. I don't think it's necessary right now, from what I know, to absolutely protect all of our population. But this is why you have more than one podcast, right?
Yes.
Because things become clearer over time.
I used to count the number of podcasts, COVID number 4. Now I'm like, man, this thing didn't go away like I hoped it would. And
we're like in like Friday the 13th movie territory. How many movies are there? There's like 12 of them.
That's a good point. But I have to say, Andy, our listeners are so grateful to the fact that we have such easy access to Pete's ID doc, who is able to share this type of information with us. I think what the sentiment that I hear from all of our families is we would have nowhere else to get this type of information on specifically COVID and Down syndrome. Like, they just wouldn't have easy access to this type of stuff if it wasn't for you doing this podcast with us. So it is much, much appreciated.
Well, I do want to shout out, though. I have benefited tremendously from being a junior member, more peripherally involved with the T21 research group, T21RS, which I think has done an amazing job of collaborative work. People like Stephanie Sherman and Andres Stridham and that group, they have just done spectacular work trying to study this in sometimes a qualitative, sometimes a quantitative way. And I have benefited so much from the organization of those folks. And, many of them were Down syndrome researchers without a focus on infection whatsoever. As you well know, there are very few people like that. But that group pivoted to really study a lot of useful things in the field. And I'm very grateful. And I'm grateful to all of the research you and I have read that people have put out there to give us some information to base our recommendations on. So yes. I think we're all very lucky that way in terms of having a community where some people are really passionate about trying to move the field forward. So thank you for having me and the kind words, but I stand on the shoulder of giants too, who have really helped me figure out what to say here.
Well, Andy, I see in the background of the Zoom call the crystal ball that you have that is a little cloudy still, but we are hopefully seeing that clear up over time. We'll see, especially as the weeks to months progress, where we are headed with this COVID still pandemic. But I'm very grateful to be able to have you if we need for future podcasts talking about this topic. Listeners to the podcast, please do know you can always send us your questions to Down Syndrome Center at chp.edu. That is by far the best way to get a hold of me. If you have any questions, I do read each and every email, so please do send that our way, and we will gladly answer any questions you may have, or bring Dr. Nowalk back on to the podcast to answer those questions as well. And also, as always, if you would like to partner with us in the work that we do here at the center, including this podcast, please go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.